everyone, and welcome to Clinical and Laboratory Applications and Diagnostic Procedures 1 here at Rasmussen College. This course was really built to help you gain knowledge on specific areas of the medical world and the structures of those systems included in those units. Each week, I will put up weekly videos to help deliver content to you, as we will not really meet in person. So for week 1, we are focusing on what we call the pulmonology or respiratory system. So for this week, we have 3 chapters that we are focusing on. That will be chapter 29, pages 640 to 647, chapter 51, pages 1198 to 1210, and chapter 54, 1271 and 1272. So let's go ahead and take a closer look at each of those chapters so we gain some more information. So for chapter 29, we are focusing on the actual organs of the pulmonary unit. Those include the nose, paranasal sinuses, pharynx, larynx, bronchi, bronchioles, alveoli, and lungs. Your nose is the organ of smell, but it's also an important component of your respiratory system. It has 4 functions outside that of smell. That is, it helps with a passageway for air. It warms and moistens inhaled air. It traps dust, pollen, and other foreign objects in the cilia like hair projections, and it assists in making the sounds for speaking and singing. Your paranasal sinuses are the air cavities in the cranial bones near your nose. Those are your maxillary sinuses over your cheekbone, frontal sinuses over the eyes, epidermal sinuses, which are behind and between your eyes, and the sphenoidal, which are behind your epidermals. Your pharynx is the tube that lies behind and connects to the nose, mouth, and larynx. It's about 5 inches long and consists of muscle and membrane. The major function for this is to serve as a passageway for food to the esophagus and air to your larynx and trachea. It also acts as a helper in speech and forming specific sounds. Your larynx is also known as your voice box. It is a muscular structure that is lined with mucous membranes and found at the end of your pharynx. Your trachea is also known as your windpipe, and it's made up of cartilage that is about 1 inch wide and 4.5 inches long. The trachea serves as an open passageway for air to reach your lungs. Your bronchi are the 2 main branches that come from the trachea and extend into your lungs, and these act as a passageway for air from the trachea to your lungs. Bronchioles are tiny structures that are composed of thin layers of epithelial and smooth muscle. These structures are only about 1 millimeter wide. Your alveoli are small air sacs that act as a support network for your capillaries. They exchange the oxygen and carbon dioxide that take place within the body. And finally, your lungs are large cone-shaped organs in the chest. They are very porous and spongy in texture, and they have high elasticity. You have 2 lungs. Your right lung consists of 3 lobes, where your left lung only consists of 2 as it incorporates the heart. And each lung is about 10 to 12 inches in length. So now that we understand the organs of the respiratory system, let's discuss the act or the mechanism of breathing. When we discuss breathing, it's the movement of air to and from your lungs called ventilation. This process is made up of 1 inhalation and 1 exhalation. An And inhalation is the active process that involves taking a breath in, also called an inspiration. And exhalation is a passive process of exhaling or breathing out a breath, also called an expiration. If a patient's having difficulties breathing, it's called dyspnea. If a patient has a lack or an absence of breathing for more than 19 seconds, it's called apnea. And if a patient has breathing difficulties in certain positions, we call that orthopnea. So that is chapter 29 for you. Let's move on to chapter 51. And chapter 51 is talking about the study of pulmonology, which is the treatment of diseases of the respiratory system. That will include your trachea, bronchial tubes, lungs, and alveoli. The primary function of the respiratory system is to transport oxygen from the lungs through the bloodstream to all the cells in your body and carry waste products from the cells through the bloodstream to the lungs to be breathed out. Now, as a medical assistant, you play a very important role in helping the provider to diagnose conditions and diseases of the lungs. We can do this through what we call a pulmonary function test, or PFT, also called a spirometry. It can be done through arterial blood gases, lung volumes, and pulse oximeters. So let's talk about each of those a little bit more in depth. Now, with a pulmonary function test, this may be performed when a patient complains of shortness of breath or difficulty upon exertion. It can also be performed on patients who have asthma, chronic bronchitis, emphysema, and cystic fibrosis. And what we will do is we will evaluate the lung function or the lung volume and capacity and show any alterations in the total lung capacity, inspiration capacity, or vital capacity. It's a non-invasive test that will be able to measure the ability of the lungs to exhale. The results will reflect the elasticity of the lungs and their ability to ventilate and strengthen the respiratory muscles. As a medical assistant, you play a very important role with this, as you will be the one who is coaching the patient through the procedure. You are their cheerleader. You will be telling them maybe what they need to change or things that they need to work on. Maybe taking a deeper breath, blowing out longer, blowing out harder, whatever that might be. You are the one that will walk them through that. Next, we have your arterial blood gases, which measure the amount of oxygen, carbon dioxide, and the pH level of your blood. We typically use this to help diagnose patients with COPD or pneumonia, but we can also use it when a patient has a fever of an unknown origin. Typically, we will have somebody who is trained in this, a phlebotomist or something of that nature, as we have to draw from the artery in the wrist, groin, or arm. Your lung volumes, or your peak flow meters, are done to help measure the patient's ability to move air into and out of the lungs. This is often done with patients who have asthma on a day-to-day basis. And what you will do is have the patient have one deep breath in and blow it out forcefully into a meter. And you have them do that 3 times, and then you take an average of what those 3 times are. Last one is your oxygen saturation, or your pulmonary oximeter. It determines the oxygen concentration in the arterial blood. A normal oxygen saturation is 95 to 100%. We can also use this on a patient's fingertip, earlobe, or the heel of a patient's foot. Now, if a patient has any sort of nail polish on, we need to remove that. If their fingers are cold, we do need to warm those up to help get the best result possible. And the last thing that I want to talk about here is TB testing. I'm sure most of you have some knowledge in this, but with pulmonary testing, TB testing is actually one of the injections that we do pretty frequently. I'm sure that most of you have already done this, so I'm going to leave this for you guys to read in your chapters or review in your lab classes. So that is chapter 51. The last thing I want to talk about is chapter 54, and that's just those 2 pages, 1271 to 1272. And what this does is really discusses the routes and methods of administering medication. With respiratory systems, the main way that you want to administer medication is through the inhalation method. That means medications are administered directly into the nose or the mouth with aerosol sprays, bronchodilators, or nebulizer treatments. Nebulizers actually take a liquid medication and turn it into an aerosol to be breathed in, where inhalers actually are already a pressurized dose of medication, and they can already be inhaled directly into the lungs via the mouth. Okay. With this, I also want to talk about some of the common disorders of this system, things such as COPD, bronchitis, croup, pulmonary edema, Legionnaire's disease, pleurisy, asthma, and pneumonia. Now, I would really highly suggest that you guys read through these in your chapter or here on the PowerPoint, as what it can actually do is it will show you guys and help you guys learn the differences between them, as it'll be important for you to know for your quiz or your discussion board, your CMA exam, your final exam. I would really tell you to look through and know these diseases, okay? The last thing that I actually want to talk about for this pulmonology unit is some of the common types of medications that we use. We typically use antihistamines, anti-inflammatories, antitussives, bronchodilators, decongestants, and immunosuppressants. Again, read through these and learn the differences between them. I know that you guys are doing flashcards, so that will start to help this, but to get a better understanding, I would tell you to read through and know the differences in these classifications of medication, okay? All right, so this is where I'm actually going to stop for this week's video. As always, I'm going to tell you each week, please make sure that you are reading your suggested pages on your own, as well as reviewing this video. It will help you to better grasp not only the material so you can complete your discussion boards and quizzes, but also to help you with your lab classes for the week. Now, each week what I like to do is I like to give you here's what's for homework, so you have a better understanding as you head into the week. So you do have one discussion board this week. Your initial post will actually be due on Thursday, July 6th, due to the late start of the course. Otherwise, it would typically be Tuesdays by midnight. For your discussion board this week, you will be discussing the spirometry preparation and the coaching method. What you will need to write on is what you think the proper way to prepare a patient for when they need to perform a spirometry test is. You will also need to explain what you think the purpose and importance of the coaching method for you as a medical assistant is during that test for the patient. Again, initial post is due July 6th by midnight, and you need to reply to at least one classmate no later than Saturday, July 8th. Responses to your instructor do not count for grading. Also, please make sure that you're looking at and reading the rubric that I put up in your Module 1 course folder to help you better understand how to put together a proper discussion board. You also have your first quiz this week. It will be over the chapters that we discussed, so chapter 29, 51, and 54. It will also go along with the lecture course that we have here and your lab course that you have on campus. It's an online quiz that consists of 16 questions that consist of multiple choice, true, false, and 3 short answer. You will have 20 minutes to complete this exam, and please make sure that you complete it no later than Sunday, July 9th by midnight. If you have any questions or concerns, guys, please make sure that you reach out to me. My direct line can be found on the home page of your course, or you can email me here through Blackboard. Have a great week 1, guys. Bye-bye.